Hey everyone, welcome back. We're going to be tackling something today that I think a lot of people are thinking about or will be soon, and that's when is it time for assisted living for an aging parent, right?
Yeah.
Um, we have this article called "When is it time to choose assisted living for your elderly parent?" and it's from a group of senior living communities,
Right.
and it's clearly in their interest to have more residents.
Yeah.
But I will say that it's a pretty insightful piece, and it doesn't really come off as a sales pitch.
Yeah.
It feels more like a guide to help us really understand the signs and,
Yes.
make a decision that's best for everybody involved,
hmm
which is what we all want.
Yeah, absolutely. And, one of the things I think they do well is they really frame it in a way that kind of takes the scariness away from assisted living.
Right.
It's not about giving up independence. It's more about finding that balance between support and freedom.
Right.
And I think that's a really important distinction.
Absolutely. Yeah, I totally agree with that. And it's about recognizing when a little extra help can actually enhance someone's quality of life, not diminish it.
Exactly.
So let's get into these 6 signs that they highlight in this article.
Hmm.
The first one that really jumped out at me was difficulty with daily activities.
Yeah.
We all have that image of our parents being super capable, but there comes a point where even simple things like cooking, cleaning, or even getting dressed,
Yeah.
it can become a real struggle.
Right. And I think it's important to pay attention to those struggles because those things that might seem like minor inconveniences
Right.
can actually be indicators of bigger issues.
Right.
So, for example, the article points out if your parent is having trouble consistently with cooking, that can increase the risk of kitchen fires,
Wow. Yeah.
which is a scary thought.
Yeah, no kidding.
Or if they're struggling with bathing, that can lead to falls in the bathroom, which for older adults are a leading cause of injury. So it's really about looking at those things and saying, okay, are these just minor inconveniences or are these signs that something bigger is going on?
That's such a good point. I hadn't thought about it that way. It's so easy to just write it off as well. That's just part of getting older.
Mm-hmm.
But when you really connect the dots, the potential consequences are really scary.
They can be, yeah. And that's where assisted living can really step in and provide that extra layer of support.
Right.
Because these facilities are designed with safety and accessibility in mind.
Okay.
They have staff available to help with things like bathing and dressing.
Right.
And they often have modified kitchens and appliances to make cooking safer and easier.
Okay.
So it's about creating an environment where your parent can still maintain their dignity and independence, but also have that peace of mind knowing that help is there when they need it.
So it's about striking that balance, allowing them to do what they can on their own,
Yeah.
but stepping in for the things that are becoming more challenging.
Exactly. Now, the second sign the article mentions is frequent falls. And I know for me personally, that one always sends chills down my spine.
Yeah.
Even a minor fall can be so traumatic, especially for an older adult.
I totally agree.
Yeah.
My grandma took a tumble a few years ago, and it really shook her up,
Yeah.
even though thankfully she wasn't seriously injured.
hmm
But what makes falls so dangerous for older folks?
Well, as we age, our bones become more fragile and our balance isn't what it used to be.
Right.
And the article stresses that frequent falls aren't just a sign of clumsiness.
Okay.
They can be indicators of underlying issues like problems with vision strength or even medication side effects.
Oh, wow.
And falls are unfortunately a leading cause of death among seniors.
Oh my gosh, that's sobering.
Yeah, it is. So I'm sure you can guess assisted living facilities are really designed with fall prevention in mind.
Yeah, I would think so.
Safety is a top priority. They have features like handrails and hallways and bathrooms,
Yeah.
non-slip flooring,
Right.
and those emergency call systems that residents can use if they do fall. Plus, the staff is trained to recognize fall risks and implement preventative measures. So, for example, they might help residents with mobility exercises or make sure they're wearing appropriate footwear. It's all about minimizing those risks.
That level of attention to detail can make a real difference. Now, the third sign that they talk about is worsening health conditions.
Yeah,
Which on the surface seems pretty straightforward.
right.
But I'm guessing there's more to it than meets the eye.
Yeah, definitely.
Yeah.
It's natural for health to decline as we age,
Mm-hmm.
but there comes a point where managing those conditions at home becomes too much, even with help from family members or home care services.
Right.
And what's really interesting is that many assisted living communities have medical staff on site and can provide a higher level of care than you might expect.
So it's kind of like that in-between step between living at home and needing like full-time nursing care.
Right. Think of it as a bridge.
Okay.
So let's say your dad has diabetes. That's becoming more difficult to manage.
Yeah.
An assisted living facility might have nurses who can help with medication management, blood sugar monitoring, even specialized meal planning.
Gotcha.
Or if your mom has dementia, they might have staff trained in memory care techniques who can provide personalized support and engagement. It's really about having access to that team of professionals who can address a wider range of needs.
Okay, I'm starting to get a clearer picture of how assisted living can fill those gaps in care. Now, the next sign they list is social isolation.
Mm-hmm.
And honestly, this is a big one for me when I think about my own parents.
Yeah.
They've always been so social, but as they've gotten older, they've definitely slowed down a bit. They don't get out as much.
Right. I think that's a common worry for a lot of people. You know, it's so easy for seniors to become isolated, especially if they're no longer driving or participating in activities they used to enjoy.
Mm-hmm.
And what's fascinating is that studies have shown that social isolation can actually have a detrimental effect on both mental and physical health.
Really?
Like how so?
Well, loneliness has been linked to an increased risk of cognitive decline.
Wow. Depression and even heart disease.
I had no idea it was that serious.
It is. And that's why the social aspect of assisted living is so crucial. These communities are designed to foster connections and provide opportunities for interaction.
Okay, so it's not just about having people around.
Right.
It's about having meaningful interactions.
Exactly. Think communal dining areas where residents can share meals and conversations, planned activities like game nights or exercise classes, even outings to local attractions.
Right.
Some communities even have things like beauty salons or libraries on site, which can be great places to strike up conversations and make new friends.
That's a really good point. It's about creating that sense of community.
Right.
Which, let's face it, can be tough to maintain as we get older, especially if we're living alone. Okay, now this next one might be a bit sensitive, but it's important to talk about. The article lists poor nutrition as a potential indicator that assisted living might be worth considering. And I think this one can be tough for families to spot and even tougher to address.
Yeah, you're right. It can be a delicate subject. But the reality is that as we age, our nutritional needs change.
Right.
It can become more challenging to shop for groceries, prepare meals, or even remember to eat regularly.
Right.
And this can lead to unintended weight loss, vitamin deficiencies, and a whole host of other health problems.
So what are some red flags that family members should be looking for? Like, how can we tell if mom or dad might be struggling with this?
Well, noticeable weight loss is a big one.
Okay.
If you see your parents' clothes fitting looser or if they just seem to be shrinking in general, that's definitely cause for concern.
Okay.
You might also notice things like spoiled food in the refrigerator,
Right.
indicating they're not eating what they buy, or stacks of unopened mail, which could suggest they're having trouble managing their finances.
Right.
These can be subtle signs, but they're worth paying attention to.
Yeah. Those are good things to keep in mind.
Yeah.
So how does assisted living help in this regard? Do they have like nutritionists on staff or something?
Many of them do. Most assisted living communities provide residents with regular nutritious meals.
Okay.
And they often have dietitians on staff who can create personalized meal plans
Gotcha.
based on dietary restrictions or preferences. And eating in a communal setting can also encourage residents to eat more regularly
Right.
and make meal times more enjoyable. It's like having a built-in support system for healthy eating.
Makes sense.
Yeah.
It's like having that safety net to make sure that they're getting the nourishment that they need. Now, the last sign they talk about is one that I think really resonates with anyone who's ever been a caregiver, and that is caregiver burnout.
Oh, it's a real thing. And it's so important to acknowledge the toll that caregiving can take on people.
Oh, yeah.
A study by the Family Caregiver Alliance found that nearly 40% of family caregivers report experiencing significant emotional stress.
Wow.
And about 20% report experiencing physical strain.
Yeah.
It's incredibly demanding, both mentally and physically.
It is. You're constantly on alert, worrying about your loved one's safety and well-being, and often putting your own needs on the back burner. I remember when my grandmother was living with us.
Right.
I was so focused on making sure she was comfortable and cared for that I completely neglected my own self-care.
Right.
I was exhausted and running on fumes.
It's so easy to fall into that trap. And the article really stresses that asking for help isn't a sign of weakness, it's actually a sign of strength.
Right.
It's about recognizing your limits and knowing when you need support. And that's where assisted living can be such a game changer for both the senior and the caregiver.
Yeah. It's like taking a deep breath and saying, okay, I need a little help here.
Right.
I know for my family, even just the thought of assisted living felt like we were somehow failing my grandma.
Right.
But looking back, I wish we had considered it sooner. I think it would have given all of us, including my grandma, a much-needed break.
It's a common misconception that assisted living means abandoning your loved one.
Right.
But that's simply not true. What it really does is allow you to shift your focus from being a primary caregiver back to being a loving family member.
You can spend quality time with your parent enjoying their company, making memories, rather than being consumed by the daily grind of caregiving.
That's such a powerful way to put it. It's about reclaiming that connection and cherishing the relationship without the added stress of like managing every single need. Okay, now let's talk about the elephant in the room, affordability.
No.
We all know that assisted living can be a significant financial commitment, and it's definitely a concern for many families, including mine.
Right. Cost is a huge factor, and it's something that shouldn't be glossed over. But I want to emphasize that there are resources available to help families navigate this. The article actually points us towards some helpful information in the resources section.
Yeah.
There's one specifically about family care in Wisconsin, and another about utilizing veterans' benefits.
Yeah, I saw those. It's like they're saying, hey, we know this is a concern, but don't despair. There are options out there. Exactly. It's about being proactive and informed. You know, one of the articles shares a story about a woman named Sarah who was feeling completely overwhelmed by the cost of assisted living for her father. And she was ready to give up, but then she discovered a program offered by her state that provided financial assistance to eligible families.
Wow.
It ended up covering a significant portion of her dad's care, and it took a huge weight off her shoulders.
That's so encouraging. It's a reminder that there are people out there who understand these challenges and are working to make assisted living more accessible.
Absolutely. And there are experts and organizations dedicated to helping families understand their options and find the best possible solution. It might feel daunting at first, but there's help available if you know where to look.
So the takeaway here is don't let the fear of cost prevent you from even exploring assisted living as a possibility.
Right.
Do your research, ask questions, and see what resources might be available to you.
Couldn't agree more. Now, before we wrap things up, I want to touch on one more crucial aspect that the article highlights, and that's the importance of personalized care.
Okay.
You know, it's not just about finding any assisted living facility. It's about finding the right fit for your loved one's unique needs and preferences.
Yeah, you mean like recognizing that each person is an individual and what works for one senior might not work for another?
Precisely. For example, someone who's always been active and social might thrive in a community with a jam-packed activity calendar and lots of opportunities for group outings.
Right, while someone who values peace and quiet might be happier in a smaller, more intimate setting with a focus on individualized activities and a more relaxed pace.
Exactly. It's about finding that sweet spot. And that involves not only considering the practical aspects of care, but also taking into account your loved one's personality, hobbies, and overall well-being.
So it's about really honoring their individuality and ensuring that they're not just cared for, but truly thriving in their new environment.
Absolutely. And this is something you can be proactive about. You know, when you're researching different communities, don't be afraid to ask about their approach to personalized care, their activities and amenities, and how they foster a sense of belonging among residents.
It's about finding a place where your loved one feels truly at home, not just a place that provides care. And this brings us to our final thought-provoking question for you, our listener. Imagine you're in your parents' shoes. What would be most important to you in choosing a place to live? Would it be the level of care, or the social connections, or that feeling of independence, or the physical environment? What would make you feel safe and comfortable and respected?
It's a question worth really reflecting on because it can really help guide you towards the best possible decision for your family. And remember, there's no one-size-fits-all answer here. Every situation is unique.
Yeah, absolutely. And, even though this is a tough topic to talk about, I think this deep dive has been really eye-opening. I know for me, I feel a lot less apprehensive about the whole idea of assisted living. It's not this scary, depressing thing I always imagined it to be. It can actually be a really positive step, both for the senior and their loved ones.
I agree. It's about kind of shifting our perspective and recognizing that assisted living can be a source of support and connection and even joy. It's about finding a place where our loved ones can thrive in their golden years.
Well said. So to wrap things up, I just want to remind everyone that you're not alone in this. If you're grappling with this decision, reach out to your family or your friends or even a professional for guidance. And remember, take your time, do your research, and trust your gut. You've got this.
And remember, the most important thing is to approach this decision with love and compassion, both for your parent and for yourself.
Thanks for joining us on this deep dive. We'll see you next time. for another fascinating exploration.